Well, in tonight's UpFront interview, we are discussing that decision to lift the mask mandates in schools in Ingham County. The health department announcing that move last night. Starting February 19th, masks will not be required in an educational setting. I'm joined tonight by Ingham County Health Officer Linda Vail. Linda, thank you for being with us tonight.
Well, thank you for having me.
So let's start with how you came to this decision. You know, we're seeing that dropping case count in Michigan, but what other factors weighed in on this?
Well, there were really a number of factors. Part of it had to do with the really precipitous drop in cases, as you've said, back to, statewide numbers we haven't seen since September. The other is, when we issued the orders, we did not have a vaccine at all for 5 to 11-year-olds, which was a significant proportion of the school population that didn't even have an opportunity to be vaccinated. So at this point in time, we have that opportunity. We have available appointments. Okay. Here in Ingham County, we have about 73% of our eligible 5 and over vaccinated, and about 40% in our 5 to 11 and 62% in our 12 to 15 age groups, which compared to the statewide averages of 26 and 47% is really quite good. So that was part of it. Then we also have to look at our hospitalizations and what's going on with that. We've got about a 34.2% drop in hospitalizations. And, other than the science metrics behind it, there are just some other philosophical things that play into making this decision.
Okay, so the Ingham County Health Department, we saw them partner with Michigan State University last month, several COVID vaccination clinics. How much do you think those clinics played into having boosted vaccination rates in your county?
Well, a lot of them were booster clinics, and the university did require boosters for students and faculty. And that, of course, increased our booster rate. That plays into it. And then one of the things we have to realize is that, we had a vaccine that we thought was going to prevent a lot of infections, 95% efficacy. We had really high hopes with a very effective vaccine and some other things that we really did have a chance at herd immunity. And increasingly, especially as we've seen with Omicron and the number of people that have been vaccinated and still got infected with Omicron, that we're not preventing all infections. And importantly, we need to look at that and say, okay, if we're not preventing all infections, is the number of cases the metric we need to look at to determine how good or bad things are? And it turns out that that's not. What we need to do is be looking at the severity, the acuity of illnesses and hospitalizations. Should another variant come along that changes the severity of infections, then that's a different, scenario. But right now, that's what we know about this. We know a lot of people have been infected with COVID by sheer numbers. They have been astounding. The month of January, we had more cases than we had in 2020 completely altogether. The month of January, we had more than half the number of cases we had in 2022. And yet you don't see the concomitant rise in hospitalizations and severe illnesses. While we still had a lot of those, by a percent of total cases, those numbers were very down. And so, we stand by the CDC's recommendation and the state's recommendation, and will recommend as well that the schools continue to require masks, but, it's not going to be by order anymore. And importantly, our local orders are in effect for another week. And part of that is really to get another week's worth of these declining cases. And also, our school districts need time to adjust and possibly determine that they're going to keep a district level mask mandate. So this is now going to be determined at the district level. And we, as we have for many, many years, are using our scientific information, data, public health expertise to basically make recommendations to support. Those should be used in guiding decision-making during a pandemic, really without the need for orders and mandates and restrictions. We've come to that time in this pandemic where relying on public health authority to order and restrict and mandate people, one, is increasingly ineffective, and two is we are going to be living with COVID as an endemic disease. And so we have got to learn to do that. And we've got to learn to do that without public health saying we're going to order and we're going to restrict and we're going to mandate things, and really informing the public, informing schools, educating them, working with them in order for them to make the best decisions possible for themselves.
Well, thank you so much. Focusing on the severity of the sickness and not the number of people who are infected. That is a different take as we move forward. And as you said, learn to live with it. And we appreciate your time tonight. Thank you, Ms. Vail.
Thank you.